Welcome to the Healthy Human Revolution podcast. I'm Dr. Marbas, Dr. Laurie Marbas, and today I'm so honored to interview Dr. Michael Klaper. How are you, sir?
I'm doing just fine, Laurie. It's good to be with you.
Well, it's such an honor to, actually interview one of the luminaries in the field of plant-based nutrition and medicine, and we have so much to talk about because not only have you had vast experience in that field, but now you're doing something to help the next generation of physicians, which I would love to talk about. But a little bit first about you. Can you tell us a little bit about how you became interested in medicine and how you kind of transitioned from maybe understanding that just traditional medicine was really lacking some very important components in? Can you kind of share with us your journey?
Absolutely. So I graduated from the University of Illinois College of Medicine in Chicago back in 1972. And for the first 10 years of my career, I was practicing regular blood and guts medicine in emergency rooms. I had some postgraduate training in anesthesiology and general surgery and orthopedics. And so I worked in a lot of operating rooms and urgent care units. And I was enjoying it. I thought that would be my entire medical career. But after 10 years, I got very frustrated in that my patients weren't getting any healthier. They were just getting more obese and more diabetic and more hypertensive. And I really didn't know what to tell them. They would come in the office and I would fiddle with their insulin dosage and tell them you ought to lose some weight. But I really wasn't helping them. And I got so frustrated that I decided to leave general practice and become an anesthesiologist. And so I did 3 years of an anesthesia residency. And while I was in the cardiovascular anesthesia service up in Vancouver, I was putting people to sleep all day and watching surgeons open their chests and open their coronary arteries. And out of these arteries, they were pulling this yellow, greasy gunk called atherosclerosis, as you well know. And one day, a particularly yellow, slithery piece of this material came out of an artery, and I thought to myself, man, that stuff looks like chicken fat. And a little voice on my shoulder said, there's a good reason why it looks like chicken fat, doctor. It is chicken fat and cow fat and pig fat and the fat of other slow animals that were walking past this man's table when he had a fork in his hand. And there were studies already in the medical journals that high-fat diets lead to this devastating disease. And my dad was already showing signs of clogged arteries and angina, and I clearly have a propensity towards that condition. And I knew if I didn't change my diet, I was going to be laying on that operating table with that striker saw going up my sternum. And I didn't want that. I saw those folks in the recovery room when they woke up, and I didn't want to be one of them. So I adopted a plant-based diet, and my body loved it. My high blood pressure went to normal. My high cholesterol plummeted. A 20-pound spare tire of fat around my waist melted off in about 12 weeks. And I felt great waking up in a nice, lean body. And this was so striking to me that I realized that I didn't want to be an anesthesiologist and spend my time putting people to sleep. I'd rather go back to general practice and help them wake up. And so I did, and went back to general practice. But now it became fun because I knew what to tell them. I knew why they were sitting in front of me, overweight, diabetic, hypertensive, clogged up and inflamed from the standard Western diet that runs waves of cooked animal protein and saturated fats and refined sugars and a whole bunch of adulterants to our bloodstream hour after hour. It's a toxic diet, and it's behind the majority of the diseases we're seeing. And I found someone, I moved to Florida, I found someone who taught plant-based cooking classes and would refer my patients to her. And those who could comply experienced the same wonderful changes I did. And the high blood pressure came down, the weight came down. There came that fateful day. I had a patient with high blood pressure called me saying, Doc, I'm standing up, I'm getting lightheaded, I feel I'm going to pass out. And so I said those fateful words, stop your high blood pressure medication. Yes, and I thought when I said that, there'd be a puff of smoke and the ghost of my internal medicine professor would appear saying, what did you say? Stop the medication. This is lifetime medication. but the man no longer had the disease of high blood pressure, and in fact, he's going to pass out. You have to stop these pills. And the same thing with my diabetic patients. They lost weight, and they were starting to get hypoglycemic reactions. And so I said, stop your insulin. And I couldn't help but reflect that in my earlier years, part of the power of medicine, oh, let's give them a beta blocker for this, for those arrhythmias and ARBs for hypertension. Now the fun is getting them off their medicines. Now the fun, oh, don't need that one anymore. We can stop that one, get them off that one. People turn into normal, healthy people with a healthy diet and lifestyle. And it's fun. I'm the happiest doctor I know because my patients get healthy right in front of my eyes. So that was 1981. And so for the past 35 years or so, I've been practicing a lifestyle medicine with an emphasis on plant-based nutrition and enjoying it just wonderfully. And this remarkable phenomenon of lifestyle medicine has taken root all around us and has now become a recognized medical specialty. And it's funny, I talked to my surgical colleagues about what I'm practicing lifestyle medicine. They say, oh, that's California woo-woo stuff. No, doctor, it's the most powerful specialty of all because it cures these people. And so I'm having a great time in this phase of my career practicing lifestyle medicine. So long story short, that's how I came to be speaking with you today.
Yes, I agree. It is really fun to stop medications, but I think more of the joy comes from the reaction of the patients. They're like, I don't have to be honest, like most recent, I had a patient who's a diabetic, came off 70 units of insulin in 7 days. And he's just like, I don't understand. He can breathe. His asthma's under control. He's like, what's going on? I get emails like I do telemedicine. And so I don't necessarily I see several patients again and again, but on occasion I'll just pass the message of plant-based eating and never see the patient again. But now I'm getting Facebook messages from complete strangers that are not friends on Facebook. And they're like, Dr. Marbas, I had to hunt you down. I did the plant-based diet. I lost in 90 days, 52 pounds and reversed my psoriatic arthritis. This was just a few days ago. And I'm like, how much fun is that?
Yes, exactly. And these are diseases that aren't supposed to go away, but they do. And and when I've been lecturing to medical students, I have a slide with the words disease reversibility. And I've been telling them these are reversible diseases. And the doctor, the textbooks will say etiology unknown, and the best you can do is manage their high blood pressure, manage their diabetes. I don't know about you. I didn't go into medicine to manage chronic disease. I wanted to cure people. And these are curable diseases if you clean up the underlying cause, their diet and their lifestyle.
Right, absolutely. And I think it's so valuable to understand as a physician, the burnout is much less when you're doing this type of work because you're allowing people to thrive. I mean, it's a bit addictive. I call it veggie crack, where you actually get addicted to helping people get well by eating vegetables.
Yes, it's remarkable. Who knew? Yeah, really.
Who knew?
Who knew, right.
I want to go back to the chicken fat incident because I do recall as well going through when you go through your, as a family medicine resident, you had to do a lot of surgery rotations and they were always short staffed and surgery residents. So I did a ton of surgeries. I was doing all sorts of cameras and helping. But I do recall them pulling out the chicken fat and having that same reaction, but my brain didn't work like yours. I wish it did. How did you go from that moment to actually going, this means plants? I mean, was there some transitional thing or was it just like, oh, this is like animal fat. I can't eat animals.
Right.
Like, how did you do that transition?
Well, it was not subtle. Back in those days, I was an anesthesia resident at Vancouver General Hospital. And up in Canada there, people, this is back in the 80s, when you had a major cardiac procedure planned, a 4-vessel bypass, we would bring the patient in 2-3 days beforehand and do all the pre-op work. And because they hadn't had the surgery yet, they weren't feeling terribly ill, we would allow them to go out on a day pass with their families because they weren't going to be going out after the surgery, that's for sure. And one evening, the nurse, making my pre-op rounds like anesthesia residents do in the evening, and one of the nurses on the ward came over and said, "Doctor, one of our patients was out on a day pass today, and when there's a couple of blood tests missing off his chart, would you mind drawing some blood on him? And if you're going down by the lab, would you take the blood down to the lab?" I said, "Sure." So I drew a red top tube of blood on this man, and I got busy on the ward, and it sat there for about an hour. And I came back to pick up the blood tube, and I looked at it, and the appearance knocked me back. As you know, when you let blood sit in a red top tube, a glass tube, the red clot settles to the bottom. The liquid part, the serum, rises to the top. And normally the serum is crystal clear. You can read newsprint through normal serum. This man's serum was thick and milky white. It looked like Elmer's glue. And when it stuck to the sides of the tube, when I shook the tube, I went back to the patient. I said, "Mr. Phillips, when you were out with your family today, did you stop to eat?" He said, "Oh, yeah, it was before I came back to the hospital." I said, "What did you have?" He said, "Oh, I had a double cheeseburger and a milkshake." And when he said that, I realized what I'm looking at is all the fat in the beef, all the butter fat in the ice cream and the milkshake, all the fat in the cheese, the egg yolk and the mayonnaise, all this fat had oozed out into his blood and turned his blood fatty. It's postprandial lipemia, as you know. And it was just so blatant. And then 2 days later, we took him to the OR. And then I got to look inside his arteries, and the light was flashing brightly at that point. And I realized that this is more than just theory, doctor. This is clearly. And so that was kind of the clincher. Then I got seriously reading about atherosclerosis and the pathogenesis of it, and saturated fats, and the role of dietary cholesterol, etc. And the pieces started fitting in place there because of what I had seen. So that really helped me move from theory into action.
Okay, so then how did you come home and make those changes yourself? What were your initial steps?
Right. Well, I was, as I said, my dad was showing, he was already had angina, and I was getting very concerned. And so by now, let's say, in the 70s, Frances Moore Lepay had come out with her book called Diet for a Small Planet, and she already had recipes there for salads and soups and rice and veggies and tofu, etc. And so I got a couple of simple breakfasts, oatmeal and fruit, or cold cereal with I would make up a cashew milk for myself at home. And lunches and dinners were big salads and hearty vegetable soups and some whole grain of some sort. Quinoa was just on the horizon there. And I was a bachelor. I would make up a big pot of soup and coast on it for 3-4 days. And I would cook like twice a week and kept it pretty simple. And so I just stayed within fairly rigid lines because it was also quick and easy. I would buy, big salad making, just make a huge salad and eat off that for a couple of days in the fridge. And I was also becoming aware of the reality of how animals are treated. And I had done a lot of my growing up on my uncle's dairy farm in Wisconsin. And I knew the truth of meat production. I saw the old dairy cow shot in the head by the butcher. I chopped the heads off chickens. I knew the violence inherent in all animal products. And I was at that stage of my evolution. I wanted to get the violence out of my life. And I knew every time I ordered a piece of steak or chicken, I was paying for the death of the animals and keeping that slaughterhouse scene going. And all the way around, I just wanted to dissociate from that. And so I did some serious looking. I was a little bit trepidatious. It was the early 80s, and there wasn't a lot of science behind it. I had to kind of back engineer plant-based nutrition because is this a safe and reasonable thing to do? And I realized that, the biggest animals on the planet, elephants and buffaloes and giraffes and gorillas, grow to thousands of pounds of mammalian muscle without ever eating cheeseburgers. I mean, clearly mammals can create big muscular bodies off plant materials. And there were already vegetarian athletes. There was a weightlifter named Bill Pearl. There was a vegetarian triathlete, Dave Scott. clearly I knew this can be done. And I didn't want to wind up on that operating table with clogged arteries. And so I just persevered. I just started getting a real taste for veggies and tofu and hearty vegetable soups and bean chilies and lentil stews. And Vancouver's a great eating town, so I was able to go to all these ethnic restaurants. And if you look, you can find the plant-based entrees around there. So it wasn't that hard to do. And as I said, every day I was feeling better and better. My running got better. I needed less sleep. I was less groggy in the mornings. My bowels were working better. Just everything, it was like a fine-tuned machine. Somebody put in really good fuel there. And there was no turning back with all the validation I was getting and from my science and my personal experience and my feelings about the animals. It was clearly the direction to go in. And boy, it sure turned out to be the right one. That was 38 years ago. And I'm turning 72 this year. I'm still the same weight. I still can run 5 miles. I still feel about the same. I don't look the same, but I feel the same as I did back then.
Right.
And it's clearly compatible with long-term health and thriving. So yes, became self-evident.
Okay, well that makes a really interesting story as well. So now you transitioned, you went back to general practice, and then there was some more evolution, right? So you tell us how you ended up at TrueNorth and what that experience was.
Right. TrueNorth is an interesting place. It's an institution in Santa Rosa, California, about an hour north of San Francisco. And the principle there is people come in with all the standard Western diseases, obesity, hypertension, diabetes, clogged arteries, and various itises of various organ systems. And they're basically given a whole food plant-based diet, but it's a really lean, clean one. No added salt, no added sugar, no added oils. Just lots of, again, oatmeal and fruit for breakfast and lunches and dinners and big glorious salads and hearty vegetable soups and big plates of steamed veggies and hearty grain dishes, lots of legumes, lots of bean chilies and lentil stews, and lots of colorful fruit for dessert. And we see these same wonderful changes. People get leaner and healthier. We get them off their medications. So that's TrueNorth and still up there functioning. The director, Dr. Ellen Goldhammer, and I met back in the early 80s. And so we had known each other for years. And he was saying, someday, Michael, you're going to come and work on the staff with us. And I was busy doing acute care medicine and other things. I thought, okay, someday, Dr. Goldhammer. But as time went on, I went down to New Zealand for 3 years. I practiced urgent care medicine down in New Zealand. And after 3 years there, I got homesick, and in 2009, decided to come back to the States and was looking for a job. And I thought, maybe this is the time to take Dr. Goldhammer up on his offer. And there was another little cherry on the sundae, to use an appropriate analogy, in that at TrueNorth, it's a nutritionally based institution, but they also do therapeutic water fasting there. And I wind up spending 8 years on the staff at TrueNorth until 2017. And saw the power of prolonged water fasting to lower high blood pressure, to cool off inflamed joints, migraine headaches go away, asthma gets better. It's a remarkable anti-inflammatory state. So I saw for 8 years nutritional medicine applied and done right, and to a maximal effect, plus therapeutic water fasting. So I got quite an education those 8 years. And it was a wonderful, wonderful time. But since then, and we can certainly talk about it, I've moved on to a larger amphitheater, so to speak, and we'll talk about that. But TrueNorth played a very important role, and it gives me the confidence now to stand in front of an audience of medical professionals and say, this stuff works. It's not an issue. you can stand in the back of the room with your arms folded and say, give me 500 double-blind placebo-controlled studies showing that a healthy diet lowers high blood pressure. But it's not an issue. I mean, it's a truism. It's physiology. These diseases get better, and I've saw it on a daily basis for 8 years, and it lets me strongly want to communicate this to young medical students and other health professionals that focusing on the food is really key to getting these people healthy.
Absolutely. And I definitely want to speak about that, having, as we spoke earlier, my own child in medical school, and she's plant-based, and seeing how she's reacting to that education as well has been kind of fun. But I just want to speak a little, because I know I'll get some questions from the audience about fasting. What about fasting? Is there mechanisms that you can explain that, why has it been shown to prolong longevity, or why is it helpful, or maybe just a little guidance on, should someone always be under medical supervision? Can someone do it safely by themselves? Or just a little bit about the fasting, kind of help us understand what that means exactly.
Oh, absolutely. And again, we now see that those of us who recognize fasting's potential, we realize we are sitting on this black box, and not a great color, of this treasure trove of possible therapeutic benefits that we're only now barely scratching the surface as far as the physiology about what really happens inside the body during a water fast. I'll go into a bit of what we know. But Dr. Walter Longo and others at University of Southern California are really delving into the physiology. And in the years and decades to come, we're going to learn a lot more about therapeutic fasting. But that said, to really understand, we need to turn the evolutionary clock back 1 million years or so. And you can imagine back in those ancient times on the African savanna, our ancient bands of foraging ancestors would spend all day pulling up roots and tubers and looking for calories. And the vagaries of nature being what they are, you can imagine that not infrequently there'd be 4, 5, 6, 7 days go by before you found that next berry bush with fruit on it, or the next carcass rotting in the sun where we can get some calories. And so these these episodes of fasting on water alone were probably the rule, and it was a very common occurrence. And when this happens, when the body stops taking in carbohydrate calories for more than 48 hours, then you deplete the glycogen in your liver and circulating blood sugar, and now you got to start burning stored fats for energy. And the body's able to make this metabolic gear shift. And as you're probably aware, as you metabolize fats, then these molecules called ketones come into the bloodstream. They're the breakdown products of these long-chain fatty acids. And the ketones in the blood are a signal that triggers quite a number of remarkable reactions in the body. And we use this at TrueNorth, and anybody can use this. But if I can be a bit circular in the reasoning here, if the body feels that, well, the body thinks that no more calories are coming in. I mean, it's been 3 days and no calories have come in. The body says, "Ooh, every stored calorie I have in my body is precious, and I don't want to waste them on reactions that don't help keep my heart beating, keep my nerves firing, essential functions." So the body looks around and shifts into this remarkable gear of conservation. Thyroid function dials down a bit, so you generate less body heat, less digestive reactions are happening. Your liver and your digestive enzymes go into more of a resting state. But very importantly, a couple of reactions that are complete waste as far as stored calories go are inflammation And so the body turns off inflammatory reactions. Why burn precious calories off as heat when you don't need to? And so we see this and we use this therapeutically. People come in with red hot joints from rheumatoid arthritis or inflamed kidneys from their lupus or autoimmune diseases. And boy, it's 5, 7, 10 days on water, boy, those joints cool right off. The liver enzymes get better, kidney function gets better. So inflammatory reactions settle down. That's a nice thing to be able to draw on therapeutically. And also, if you think about it, if the body thinks it's starving to death, something else that's a complete waste of precious stored calories is running a malignant tumor. That's a complete waste of energy. And so cancers, some cancers, the body dials down the cancer growth. Well, how does it do that? Well, it turns out, and I only learned about this in recent years, the body is so amazing and intricate. The body generates these remarkable molecules called sirtuins, S-I-R-T-U-I-N-S. These are acetylate inhibitors that basically throw a spanner in the wrench of cancer growth, and it dials down cancer growth. We see this TrueNorth. We had 2 lymphomas just melt away on prolonged water fast. There's many reports in literature of breast cancers, prostate cancers. The hormone-driven cancers really seem to dial down their growth. So this is a very powerful therapeutic tool that turns off inflammation, can turn off some cancer growth, and it's kind of rebooting the computer. When the body is fasting, a lot of cells that, especially in autoimmune diseases, that are pumping out these inflammatory antibodies. Well, after 7, 10, 14 days on water, those cells kind of hunker down and they stop putting out a lot of the pro-inflammatory proteins. And when you start eating again, those stem cells wake up and they put out a lot cleaner assortment of proteins. And people with we notice this in white cell lines. We find a lot of these rogue antibodies in autoimmune diseases are gone after a water fast. Now, that brings me to a very important caveat. We can talk about the biochemistry of fasting. As I said, we're just beginning to learn about it. But also, as much as I sing the praises of water fasting, we have to be very clear that if one does a wonderful 7, 10, 20-day water fast, but then you go right back to eating cheeseburgers and pepperoni pizzas, then Cinderella turns back into a pumpkin within days. Everything comes back. The high blood pressure comes back, the joints start hurting, the weight goes up, diabetes comes back. It all puts you back to where you were. And so as we learn and practice at TrueNorth, during the water fast, this is the time to educate the patient about what to eat after the fast. That's the most important thing. And what you eat is a whole food, plant-based diet. And so we send them to cooking classes. We have food demonstrations. They play videos in their room. And no, it's not cruel and unusual punishment to go to a cooking class while you're water fasting, because one of the benefits of being ketosis is hunger dials way down, and people aren't hungry. By day 3, 4, you're not even hungry anymore. So that's how we can do these long water fasts. When we say 21 days, oh my God, 3 weeks without food, I get hungry missing lunch. How can I go 3 weeks without food? Well, your hunger is gone. And not only that, a lot of the energy that the body uses all day to digest your food, to run your intestines, to make liver enzymes, stomach acid, well, on a fast, that energy is freed up, and people feel it. They'd stop me in the courtyard of TrueNorth. Doc, I haven't felt this great in years. I haven't eaten in 3 weeks, but I feel wonderful. You know, it's counterintuitive. You think you're going to be cold and tired and hungry and whimpering on the bed. And most folks, they're not hungry. They feel light and energetic. It's a remarkable state. So as I said, I don't want to go too long. We're just learning about this. And the place where this ends is this. anybody, after you've practiced a bit, start with a 1-day fast, 2-day fast, anybody can do 3 days, 4 days, up to 5 days at home, unsupervised, if you're basically healthy. If you're not on medications and you're basically healthy, you can do a 5-day fast at home, but start with just 1 day, 2 days, slowly build up over the course of several months. And we're learning that the so-called intermittent fasting, to do a 5-day water fast once a month at home, really spruces up your immune system, keeps a lot of these maladies from coming back as far as blood pressure and inflammatory reactions, etc. But there is a caveat. We have learned that medications get potentiated on a water fast, and you don't want to do a water fast on beta blockers or on hypoglycemic agents. You'll get yourself in trouble. So if you do have medical issues, if you are on these potent medications that you can't stop, then you really should be at a place like TrueNorth, where there are doctors there checking you twice a day, doing blood tests, hovering over you, making sure everything goes okay. These are medically supervised fasts, and that should be done in a location like TrueNorth. There are several other centers now have opened up where supervised fasting can be done. But it's a very powerful modality that I've come to respect and have a lot of affection for. And we're going to see more and more of it as people get into these intermittent fasts, as well as what's called time-restricted feeding, just to stop your eating at 6 in the evening and don't eat again till noon the next day. Take 18 hours every day of letting your body do a little mini fast, and that's beneficial. Anytime you spend not eating is a good idea. So we're learning so much about it, but we're again in these early formative days about learning how to use this to the best advantage therapeutically.
That was wonderful. Thank you. As far as, do you think this time restricted feeding or the intermittent fasting that, you mentioned 18 hours or 16/8, where you're eating within this time window and fasting the majority of the other time, or these prolonged 5-day fasts per month are more beneficial, let's say for weight loss or disease management? Do you have a preference, or have you seen that at all at the TrueNorth? What's your experience?
Sure. Now, you mentioned an important factor there. I heard the words weight loss go by. And when people think about fasting, oh boy, and they would come to TrueNorth, Doc, I want to do a 30-day fast and lose this 50 pounds. And, yeah, it doesn't work like that. The reason why is that a lot of the weight loss that happens, especially initially, a lot of it is just water out of the tissues. People eat such high salt diets from all the restaurant meals and all that they've got pounds of water in their tissues. Well, they dump that in the first week of the fast. And then there's the glycogen out of their muscles gets depleted. So a lot of this weight loss is not really fat tissue melting away. And when they start eating again, most of that weight comes back again. And I tell patients, if you're going into this water fast to lose weight, you're going to be disappointed. Well, water fasting is a medical procedure to lower high blood pressure, cool off inflammation, rebalance your guts and your immune system. It's a medical procedure doing. Weight loss will happen after the fast. The weight loss happens by keeping your belly full of whole plant foods with their high fiber and high water content. You eat soups and salads and veggies day after day, week after week. That weight's going to melt off of you naturally, healthfully, not because you're forced it with a prolonged water fast there. So weight loss is not really the focus when it comes to water fasting. It's a medical procedure to rebalance the body. As far as, so it depends what, the purpose of the fast. If it's just if you're basically healthy or you got a few pounds to lose, it gives you a bit of a jump start. And so, as you know from primary care, when they say, what's the best exercise to do? Well, it's the one the patient will actually do is the best exercise. Similar with this fasting. If the person is really up for a 5-day water fast once a month, well, that's just great. But if all they can do is just put off breakfast for 6 hours and that's all, that's wonderful. So whatever they can do, they're going to get benefits from both, and they'll learn more about it as the weeks and months go by. They'll learn what feels good in their body. But again, we we spend so much time eating. It's become a recreational activity in the society. And just to get off that train for a day or two or five is a wonderful thing. Our bodies really enjoy the respite from this constant eat-a-thon that we've embarked upon in our society.
You'll have so much more time on your hands.
You do, absolutely. You realize how much time we spend shopping and prepping the food and cooking the food and washing the dishes. On a fast, you got time to read, go out for a walk, meditate, call your mother. There's so much. Really, it's not a small matter. It's amazing how much time and energy we put into this whole food thing.
And how much money you'd save.
And how much money you save, absolutely.
There's only benefit after benefit here. Oh,
absolutely.
So that brings us to, so you left in 2017 to embark on a new endeavor. Can you share a little bit, how did this all come around? Like, how did you decide to go now back to the roots of where medicines and our doctors come from and enlighten those new generations?
Thank you for that question. Well, as I mentioned, I spent 8 years on the staff at TrueNorth. I saw several thousand patients. I supervised several thousand fasts and got nutritional medicine done right. I feel comfortable in applied nutritional medicine. And I thought that's what I'd be doing the rest of my life, but I was turning 70, so getting the 71 was on the horizon. And as noble and wonderful and beautiful and trailblazing as TrueNorth Health Center is, the reality is I was putting in these long, intensive days with these individual patients with their obesity and high blood pressure and diabetes, and I was slogged through a long day and do the write-ups and review the lab tests and see the inpatients. But at the end of the day, I'd seen 8 people. With all this intensive effort, and the end of my career is beyond the horizon, way out there. And I said, Michael, is this going to be where you end your whole career? And I realized that my profession, our noble profession, as wonderful as it is, has been derelict when it comes to the importance of the role of our patients' diet in these diseases they bring to us each day. And it's become embarrassing that we practice medicine as if what our patients are eating has no effect on these diseases. We ask them about what meds they're on, or their family history, what they do for work, but I get, like in the Harry Potter movies, I think the arch villain Voldemort, the name that must not be spoken. Same thing with nutrition. Don't ask about what the patient's eating. Yes, ask about the patients, what they're eating. That's why they're sitting in front of you, overweight, diabetic, hypertensive, clogged up and inflamed. It's the food. And yet these young medical students are going through their education and nobody is saying this to them. And they're going to spend the rest of their lives treating diet-related diseases with beta blockers and ARBs and metformin. And they're skimming the surface of symptom treatment when they're not getting to the root of the problem. And I realize, as much as important, as seeing these patients are, what I would really like to do is go to the medical schools and give those young students the lecture I wish someone had given me 50 years ago. When I was a first-year student in 1968, I wish someone had told me that, listen, you're not going to be seeing smallpox and leprosy. It's what you're going to be seeing: obesity and diabetes and clogged arteries, and what your patients are eating. And before you order another $1,000 scan and another $500 genetic blood test, ask your patients what they ate yesterday. And if the litany comes out full of burgers and buffalo wings and egg McMuffins, that's all you need to start there. That's the issue. And nowadays, there's more and more plant-based dietitians that are making themselves available, because when I mention this to some of the older physicians, well, I don't know anything about nutrition, and I don't have time. I only have 7 minutes with patients. I don't have time to get into this. You don't have to, doctor. You just recognize that there's a dietary disease in this person who's sitting in front of you, and mention that to the patient and say, you want to get rid of your diabetes, you want to get rid of your high blood pressure, you want to get rid of your inflammatory joint disease. It's what you're eating. So see Miss Smith, the plant-based dietitian down the hall. She'll guide you into better eating habits, and come back and see me in 2 weeks. Let me see how you're doing. That's how medicine should be practiced these days. And you too, then, I tell the students, well, watch your patients get healthy, and medicine will get fun, and your patients will love you, and you'll love medicine. Because if you just slog through symptom after symptom, you're going to burn out. After 5-10 years of that, you're going to say, my patients you'll be in the same position I was so long ago, where you say, nobody's getting healthier here. So I've been going around to medical schools. We have started a nonprofit initiative called Moving Medicine Forward. And I've been going to the medical schools and talking to the students. I've been to University of Michigan, University of Washington, Seattle, up to McGill in Montreal, down to University of Florida, Gainesville, University of South Florida in Tampa, Nova Southeastern in Davie. I'm going to Wayne State. I've been to Wright State. Going to these medical schools and delivering these lectures. The students love it. They come up to me afterwards saying, thank you, a real live doctor said this to us, because it's 2019. In every first, second, third year medical school class, there's now 20, 30, 40 students who've seen movies like Forks Over Knives. They've seen What the Health. They've seen Eating You Alive. They have the lights on. They get it. They already know it. And so people say, well, how do you get into the past administration? Because they're right, the administration doesn't want to hear from Dr. Klaper, because it's a very disruptive message that I'm bringing, and I haven't been in academia for many years. So we just do an end run around. We go to the students directly. We find the most nutritionally aware students. They're often members of Physicians Committee for Responsible Medicine or other organizations. We locate them and say, how would you like to invite Dr. Klaper to your school? And they form a nutrition interest group. They rent the lecture hall. They put up the notices on the bulletin board. They send out the e-blast. They arrange for the samosas from the Indian restaurant so they give out free food. And we put on the event. And we've been getting 150 people every event, medical students, nursing students, dietetic students, surgical residents. And I give them the lecture and show them how these diseases, how the standard Western diet plays a role in creating these diseases, and how a whole food plant-based diet reverses these diseases. It's not strange or exotic. It's a simple physiology. When you stop hitting yourself in the head with a hammer, the headaches go away. It's not that hard to understand. But it's more than just, I don't want this just to be a one-time drive-by lecture. I want them to do two other things. One, as I said, I want them to form a nutrition interest group and meet once a month and discuss nutrition-based cases. I will Skype in and lead the discussion group, but I want them to keep nutritional medicine alive in their awareness, because it's the majority of what they're seeing in the clinics and in the emergency rooms and the cath labs. It's what their patients are eating. And once what you know about, you see. And once they click that lens, they're looking through the lens of nutrition. Oh, that's why that patient's obese. That's why their arteries are clogged up. So I want them to keep the interest in nutrition going. But the third aspect of our Moving Medicine Forward initiative is I want them to work with the curriculum committee at their own medical school to get nutrition taught in all 4 years of medical school. It should be part of the medical school education canon. And as they go through physiology class and pathology, they should be talking about the role of diet in each of these basic sciences. And certainly when they get into the clinics, whether they're on the GI service or pulmonology with their asthma patients, GI patients with Crohn's disease and colitis, rheumatology with the inflammatory joint disease, certainly all the vascular services with the atherosclerosis. It's all about the food. And once you see that, and you see these diseases go away with plant-based diets and a healthy lifestyle, then they get it. And so I'm trying to spawn a generation of nutritionally aware physicians who come out and routinely ask your patients, what are you eating? Take me through a typical eating day. What do you really eat? Who does the shopping and the cooking in your house? Ask that question to every patient, and then listen to the answer, and you'll have the key to getting these people healthier. Every young medical student needs to know that, and nursing students and dietetic students, they all need to hear that message. So this has got my passions going. This is what I really want to do with the rest of my career. Now, there's 130 medical schools in North America. I'd like to visit most of them, but eventually put this all online. And once a month or twice a month, do a Google Hangout with medical students across the country, send them all a nutrition-based case, discuss it, get their input, see what challenges they're running into, make the medical students a large family community, and create and kindle that awareness of nutrition as both the cause and the cure of their diseases they're seeing. And medicine will be fun for them, and they won't have to go through all the travail you and I've gone through to get to this point.
Yeah, so when we're done here, I'd like to talk to you about that. I may have some help for that. So,
oh, that's great. If people, I'm sorry, if people who are watching this interview would like to learn more about our work and would like to help, because plane tickets are expensive, they can go to my website, drklaper.com, doctorklaper.com, 1P in Klaper, and click, and at my website, you'll see Moving Medicine Forward up on top. Click on it, and you will see, a one-page write-up on our work there. And two important little boxes to click on. Yes, if you would like to donate some funds, that would certainly be welcome. You can do that there. But there's also a little gray panel at the bottom that says, do you know a medical student or someone on the staff or faculty of a medical school who would you like to have Dr. Klaper come and lecture to? Click here, give us their information, and we'll contact them. And add one more medical school to our list that's been visited. So I would encourage people to, again, go to my website, drklaper.com, and go to Moving Medicine Forward and learn about our work and see how you can help and steer us to a medical school that needs to hear this message.
Wow, that's fantastic. Well, there's going to be a little Emily Marbas going to be contacted.
Great, wonderful. Looking forward to
working on this one.
That's great. That's wonderful.
That is wonderful. I can't even tell you when I think about what you're doing, because I've always thought, we need to go back to the medical student, because that really is, that social contagion. So in family practice, I had anywhere from 1,500 to 2,500 patients on my normal panel, depending on where I was. And now imagine if you hit those, you have thousands of people and you have each person, and there's these are people who are respected in their community, they're authority figures, they're respected, and then they hit one person and they hit the next and the next. I mean, how rapid this movement can go when you have physicians who are properly educated and understand the value of nutrition.
Absolutely, absolutely. No, it's a positive feedback loop there, and yes, that's a virtuous cycle. And let's start those wheels turning. Absolutely. I wanted to become, of course, of course I ask my patients what they're eating. It's the most important thing. But there's some resistance. So a lot of established docs don't want to hear about it. But I don't know if medical history is even discussed any longer. But there's a great story about John Snow, a physician in London in 1756. There was a terrible cholera epidemic, and that was killing lots of people. And John Snow was a physician in London, and he got a map of London and made a mark where all the cholera cases were coming. And he noticed that everybody was getting their water out of the pump on Broad Street. And turned out that the Broad Street pump, there was a lady rinsing her diapers in the intake pipe there, and was contaminating the water. And And John Snow went to the city fathers and said that the pump water is contaminated. Well, this is before the germ theory, and they all just blew him off, and that nonsense couldn't be the problem of the city. And John Snow knew that it was, and so he finally took matters into his own hand. And the classic story is John Snow took an axe and one night went over and cut the handle off the Broad Street pump, and he ended the cholera epidemic. And that's practicing medicine at its best. And I'm trying to do a similar thing here, go right to the source here already. And I don't let the naysayers say it. Let's go right to the students and wake them up, and let's change medicine. Let's move medicine forward.
Right, that's a great way to title it. And I really need to, I was not aware of that story. I will be doing some research when we're done here. It's so fascinating. Oh my goodness. Oh, that is incredible. So now you've gone to how many schools?
Let's see. I've been to 11 so far, and I'm leaving for Michigan next week. And then, and you probably are aware of this. Let's see. I'm going to Beaumont Medical School in Michigan, then to Wayne State. I was already at Wright State, at Wayne State, and University of Michigan, Ann Arbor. But then I'm coming back, changing socks, and getting back on another airplane and flying to Lithuania, where I was approached by the Minister of Health and the chairman of the medical department at the university in Lithuania to give the keynote address at their lifestyle medicine conference. And I said, why in the world? I'm really surprised that Lithuania has such an interest in this. They said, oh, yes, doctor. And so the story is, and this is quite a seminal story for us all. He says, we're a small country. We've got one medical school. We do 3 heart operations a week at the most. And our country's getting more affluent, and our people are eating more meat and more cheese and more sugar. And the Western diet is encroaching, and we see this tsunami of clogged arteries bearing down on us. And it's going to bankrupt us. We're going to wind up sending everybody to Switzerland and Austria and Germany for heart bypass operations. What we really need to do is educate them to change their diet to a more plant-based one and prevent this disaster from happening. And so they have a very active chapter. They have a master's program in lifestyle medicine at the University of Lithuania in Kaunas, their medical school town. And they're quite sophisticated. And so I accepted the invitation to go over there and speak in Lithuania. And about 2 weeks after that, I get an email from the head of the medical department at Warsaw University Hospital saying, Dr. Klaper, we hear you're going to be in the neighborhood in Lithuania. Would you mind on your way out stopping in Warsaw and give grand rounds at our hospital here about lifestyle medicine? And absolutely, of course. But it just shows the power of this concept. And now there's the Australian College of Lifestyle Medicine, the Malaysian College of Lifestyle Medicine. I was just at the University of Guadalajara in Mexico. There's the Mexican College of Lifestyle Medicine. It's a worldwide phenomenon. Us lifestyle doctors seeing this around the world. And people say, well, show me the double-blind studies. Don't tell us we're not seeing this. It's a truism of physiology at this point. And yes, the studies will come. But I've got a slide in my show and my presentation. It's a little controversial, but I'm pushed to the edge. I list all the major diseases: the diabetes, hypertension, obesity, etc. And I've got a red sign across it. These are all reversible diseases. And then the next slide says, you want to heal these patients or don't you? Why did you go into medicine? You want to heal them, or you want to just be an enabler of their disease? Well, raise your metformin dosage, come back and see me in a month.
Right.
That's bankrupt medicine. You want to heal these are all reversible diseases. You want to heal these patients or don't you? And I'm assuming that's why you went into medicine. And you have the power if you sit down and talk honestly with them. People, oh, they'll never change their diet. They do. Not everybody. I said, Doctor, that's not your responsibility, but you at least owe them a one-page handout on the way out the door. By the way, you want to get rid of your diabetes, you want to get rid of your hypertension, you want to get rid of your inflamed joints, read this handout and go see Ms. Smith, the plant-based dietitian. You at least owe them that much. Whether you do it yourself or not, you at least owe them the information in this day and age. We know too much. How dare we withhold this information any longer? It's unethical to withhold this any longer. And it's a dawn of a new era in medicine. And you and I are working to birth this new awareness. But it's the only game in town, you know, and it's so hopeful because it's just food. Yeah, it's low tech. Everybody eats, and it's a matter of education. You know, the word doctors, you know, comes from the same Latin root as doctrine as teachers. We're teachers, and that's the best form of medicine. Teach them what to eat, and they do change. Not everybody, but then you can only do so much. You can lead a horse to tofu, but you can't make him eat it. But we at least owe them the information. How dare we withhold this any longer? So, and it's exciting. The students are excited to hear this because a lot of them they're already vegan. Half of them they're already aware of the importance of a healthy diet. So I just want to give them a big validation of that.
Absolutely. I love that. I almost consider myself, I have to be a better marketer. So I have a master's in marketing or business MBA as well. So I took marketing classes and I do a lot of, social media stuff. So I'm thinking, well, how can I present this in a way that's better and more exciting than the current way? So it's so easy. All you have to do is shift a patient's view of their future, right? It's like, okay, let's look at where you're headed. This is pretty straightforward. There's thousands of people, millions of people before you, and they leads to 6 foot underground or amputations or whatever. Or we can do this. This is the alternative future, and walk them through that and tell them the possibility and sharing the stories. I have a really big number of people who at least move in this direction, if not 100%. So it's really fun to kind of outmarket the marketers.
Oh, it really is. Absolutely. And it's the most important thing. We're talking about people's lives because there are people dying on operating tables during coronary artery bypasses that they don't need. You can melt that plaque away from the inside. And we are hurting people by not focusing on what they're eating and their lifestyle practices. And real people are suffering real travails here and often with fatal outcomes. And it's just not right to let that continue. So it's time to get that new era of medicine birthed and active and restorative.
Yeah, and I always like to mention, with those physicians who are very resistant at first, I said, it doesn't mean that we're shunning, traditional medicine at all. If anything, it's a marriage of two very powerful converging forces that if you will use the foundation of nutrition with medicine, oh my goodness, it could be phenomenal.
Absolutely. Absolutely. You mentioned marketing, and there's a lot of marketing needs to be done to our colleagues because there's 3 big impediments. One is that the doctors, we're not taught anything about nutrition. We get essentially zero application. We get I got nutrition for burn patients, nutrition for patients with kidney failure, but nobody told me about the effect of the patient's daily diet, running this toxic diet through their tissues hour after hour, what that does to the body. No one mentioned that to me. And so it's important to get the information out there. But also, nutrition, it's not sexy for many docs. It's a sissy side, not real medicine like surgery and cardiology. The nutrition, boring stuff, they think. Send it to the dietitian. That don't bother me. I'm up in the OR doing real medicine. But ironically, for that dismissive attitude, these young erstwhile surgeons and cardiologists are going to spend the rest of their career up in that operating room at 3 in the morning and in that cath lab at 4 in the morning dealing with the infections and the amputations and the infarctions from what their patients are eating. They're going to be dealing with dietary diseases all their careers. And this is nothing to dismiss. You've got the key to curing these people with a healthier diet. And so it's a matter of marketing to our colleagues the importance and the sexiness of curing patients, of reversing these diseases. That's sexy. And the third, and it's one of the biggest obstacles, is that the doctors, they're eating the same stuff themselves. They're eating their burgers and pizzas and buffalo wings. And at 3 in the morning in the hospital cafeteria, that's all that they're serving. And you wind up with that sad spectacle of a doctor with a big pot belly and a pocket full of beta blockers and ARBs and metformin, because they're hypertensive and diabetic. You can't, how can you, when you walk in the room, you want to be a good example for your patients of a healthy healer. And so we really need to help our colleagues understand the importance of nutrition for not only their patients, but themselves as well. And again, you want to heal these patients or don't you? If you really do, then let's get serious about a truly healthy diet. And what is it? It's ordering the bean chili instead of the beef chili. You know, that's the huge sacrifice we're asking them to make. But it literally makes all the difference in the world. And as you know, there's great environmental aspects to this as well. And if you got kids, you should care about this meat-based diet because it's destroying the planet as well. And I'm reading David Katz's book on the truth about food, and he makes it very clear. It's huge. I'm on page 400 of it. It's a brilliant book.
Yeah.
But he's a beautiful spirit, because he says, I'm giving you the real truth about food and all the aspects of it. But if we do not change our diet and the environmental consequences play out, none of this makes any difference. That we're going to have a non-inhabitable planet because industrial scale agriculture is animal agriculture. Is destroying the forests and the waters and the soils and putting greenhouse gases in the air. It's the driving force behind so much of this environmental destruction we're facing. That it's a real imperative. This is beyond cholesterol levels at this point. We really need to change as a species, not just individuals. We're being asked to evolve our diet to plant-based ones for our own survival as a species on this planet.
Well, and not only that, though, the world will be uninhabitable, but we're going to have very sick kids, right? So the kids born in 1990, so my kids were born in the early to mid 1990s, and that generation has double the risk of colon cancer, quadruple the risk of rectal cancer. And why would this generation be having more cancer, rectal cancer, than previous generations? It makes no sense, other than what has changed is the food. And so I'm using these statistics saying, wake up, what do you think it is? But it's funny, when I post it I belong to a lot of social media groups with this, like mom doctors and stuff, and I'll share these information. They go, what do you think it is? I was like, what do you think it is? It's the food. What do you think that is? This is not, and then they come up with these other, excuses about bizarre behaviors or whatever. And I'm like, what on earth is wrong with you? Wake up. Like, what goes in your mouth? What touches your colon? I mean, come on. So
absolutely. In fact, I agree. When I was at TrueNorth, I had a plaque on the wall, which is right behind me here. Excuse me. Let me get it for you. It'll make the point.
Okay.
When my patients would be sitting in front of me, overweight, hypertensive, diabetic, and on a bunch of medications, and I said, Doc, how did I get this way? Is it my genetics? What's the problem? I would point to the plaque, and the plaque says,
it's the food. It's the food all along. Is that what it says? It's been the food all along.
And that's the truth of it. I've been this way since high school. What have you been eating since high school? It's been the food all along.
My parents, it's genetic. I'm like, well, what else did you inherit? Eating habits. Seriously.
Absolutely. It's been the food all along. Absolutely. It's the food.
But I've been exercising, Dr. Klaper, all day. Why aren't I losing weight? Or why is my diabetes not better? Exercise is good, but it's still the food.
Good. I have a friend, Ray Cronise, who's used to be a NASA scientist, and he's into metabolism, and he went to the Westin Hotel in Atlanta, 73 stories high, went down to the basement, put on his metabolic measuring mask that measures how much carbon dioxide he's breathing out, so he can calculate how much energy he's burning. Ran up 73 floors in 20 minutes, and then calculated how much energy he burned to do that spectacular feat of physicality, and he translated into Oreo cookies. How many Oreo cookies worth of energy did he burn running up 73 floors in less than 20 minutes? 3.
Oh.
And there's so much energy in the sugars and fats, and our muscles are so efficient that, as Ray said, you can't out-exercise your mouth. You know, the exercise is not about weight loss. It's about fitness. It's important, but it's the food, man. It's the food. It's the food. It's the food.
Ray
Absolutely.
he's a force all in one. And
Yes, he is. Yes, he is.
Ray,
You know him.
yeah, I know Ray, and he's like he's always experimenting in of one.
Absolutely, but he's right
funny.
there with it, though. Yeah.
Right. Wow. Yeah. And him, him and Juliana have had some really interesting interviews with Ray, or excuse me, with Rich Roll. Really cool. If you guys want to listen to some good interviews, but Rich Roll has done some good ones with him. So that is so amazing. Well, Dr. Klaper, I don't know. There's been so much. We can probably talk forever, but just at the final note here, what would you say to someone? Let's say it's a medical student or a doctor who's listening, because I do have a lot of medical professionals who listen. What would be that one bit of advice to tell someone, you know what, you're on the edge? What's that final little tip them over to the green side?
Right, yes. When you're trying to practice the best medicine you can, the physician ultimately is a seeker of truth. When you are looking at an x-ray, a chest x-ray, and there's a lesion in the lung, it could be a dozen things. It could be a tumor. It could be an infection. It could be an aspirated foreign body. It could be no, did I just lose you here?
I'm here.
You still there? Okay, sorry,
Yeah.
let me go back here. Okay, it could be, okay, I lost your nuts. But I can't see you, but as long as you can still see me, that's good.
I can still see you. Can you hear me?
Okay, yes, I can hear you.
Okay.
You're looking at the only thing that matters is the truth. And you may be I really think that's a pneumonia. But if it turns out to be a cancer, then you've got to drop that previous idea of your diagnosis and go for the truth of it. And the same thing when it comes to our medical model of how we're going to treat people. And you can really be focusing on diagnosis and various treatments, but when that little message comes along, it's what your patients are eating. Start there. You've got to be willing to abandon the other previous model and become the most effective physician you can be. And that's going to start with educating yourself about the importance of nutrition in the role of disease causation as well as therapeutics. So until applied nutrition is taught in medical schools, then it's up to you to educate yourself. Become a member of the American College of Lifestyle Medicine. Go to the meetings of the Plantrician Project. They're meeting in Oakland in September. The lifestyle medicine folks are meeting in Orlando in October. Come to these meetings and take the online seminars because, as Goethe said, what you know about, you see. And so educate yourself, read Dr. Katz's book, and be humble enough to realize that maybe the original model that we were given, it's of the 20th century. 21st century medicine starts with diet and lifestyle. And if you do that, if you're willing to make that leap, then be prepared to have medicine become exciting, rewarding, and give you the satisfaction of your career. That's really why you went into medicine in the first place. So a new era of medicine is dawning. Be part of it. Don't resist it. Learn all you can, and the rewards will be very, very great.
I think that is beautifully said. And I think from now on, I'm going to be asking my, colleagues who are a little bit skeptical, say, you know what, are you really a seeker of truth for your patients, or are you a closed-minded individual who chooses to live a life that could be harmful to others because you've chosen to close your mind? And so I like that. Seeker of truth is so very, very important. So
Indeed.
thank you, Dr. Klaper. And we will be so honored to see you in your future and talk to you more about as you go through and talk to those in Lithuania and just kind of keep abreast of your travels and your journey down this moving medicine forward.
Thank you, Laurie. You did a great service to our cause here and to every viewer who watched this. You're practicing high-grade medicine here. Again, we're teachers, basically, and I think you've helped educate your audience on some very, very crucial issues. So it's an honor and a delight to be part of this with you. We practiced some good medicine today, so thanks for the opportunity.
Thank you. 1 second, okay? 1 sec. Okay.